So we're
Ooh,
going to
yeah.
welcome Shane to do a little presentation tonight. Like I said, Shane Vandenameele is a registered nurse who's been working since 2013. He's been on orthopedics, mental health, home care, and chronic disease support. He's the new interstitial lung disease nurse clinician since August, and he works closely with Dr. Locke and Dr. Marcoux with the ILD team here in Saskatoon and province-wide. And so I'm just going to pass it on to you, Shane, and I'll let you take over the meeting.
Thank you. Hi, everybody. So I was introduced. You know who I am now. And I interacted with quite a few of you just through my time in being in clinic. And so now you've kind of, some of you get to put face to the name. As said, I kind of, this is my second crack at coming to you guys in this meeting and kind of trying to, get some content to you that I think is worthwhile and I think is helpful. Because of my background in mental health, I was a community mental health nurse for a time, and quite often we look at different disease models and different healthcare models, just in how we deliver care to people and what we, how we try to connect with our clients and the people that have, specific diseases, especially chronic diseases. And so this one kind of jumped out at me just coming into the Christmas season here, and just a lot of people aren't really, they live with their chronic disease, but they're not they're not as thoughtful as they think they are about it. And I'm not saying that specifically about anyone here. It's just, this is, an exercise to think about how our life is impacted by our chronic disease and the ways that we kind of go through our day and try to manage it and engage it. So I'm going to just start sharing my screen here. I really don't want this to be me kind of talking at you. Like, I think a lot of people here are done with going to school. Nobody really, nobody wants to be talked at and lectured to. And so I'm going to go through, a few of my slides. And if something comes up, I do encourage you to share and to ask me some questions. I don't have many slides, but they are helpful just in kind of our, guiding our discussion. And so this is kind of a self-care and chronic illness. I want to apply it to our, specifically to interstitial lung disease. Now, when I say that, I just mean that technically this specific model was designed for use in a congestive heart failure setting. But I think that it really is relevant to us here when we speak about chronic lung disease, because the goal is just to get us to be reflecting on how we're engaging with our disease, right? And how we're engaging with our diagnosis, and just being thoughtful of how we go through it. And so within this model, there's kind of three different parts. And so there's the self-care maintenance, our self-care monitoring, and the self-care managing or management. And so there's kind of these three phases that come into this. And so with regards to self-care maintenance, when I talk about self-care maintenance, what I mean is the behaviors that we do to maintain our physical and emotional health, right? And so I've listed a few of the things that really jump out to me with regards to this. And some of these things seem kind of blah, like, yeah, duh, Shane, like I'm doing these things, right? And so, but it helps sometimes to think about it as the process and the steps, because there might be some gaps that we don't identify unless we're thoughtful about how we approach our disease. And so some of the big ones, the big behaviors that we use to maintain our physical and emotional health is, we take our medications as prescribed. Now, a lot of you are on many different medications that might help support different diagnoses. And it gets pretty darn complicated. And so learning about your conditions and learning about your medications are also kind of the self-care maintenance behaviors that we don't think fit into this, but they really do. So that continued learning about your diagnoses, your exercise and rehabilitation, engaging in pulmonary rehab is just one of the many ways that you can go through your day, especially with a chronic lung disease. And we often talk about it like it's the gold standard, and it is. It's quite lovely for people to be able to get to a rehab place, but we live in Saskatchewan, right? And so not all of us can get there all the time. Sometimes their health or their time limited. They might only let you do it for 8 weeks or 12 weeks, or you can't get there on certain days. And so it's just building exercise and rehab into your day. It doesn't have to be too formal, as long as we set aside a little bit of time for it each day. Proper nutrition. This one can be hard because with a lot of with your lung conditions, cooking and eating, going through those processes, getting out to the grocery store, shopping, like everything is difficult at times. And so it's sometimes, really difficult to get proper nutrition, not to mention that everything's expensive. I have 2 boys and it's grocery bills are a big thing. Smoking cessation and taking into account that like vaping and the secondhand smoke that we might be getting into our lives, that's a self-care maintenance tool that people can use too. And then limiting the effects of kind of negative behaviors. And by that, I mean, if you are continuing to smoke or vape, just trying to cut down as much as you can, right? Like quitting totally might not be possible for everybody. Like it might not just be something that they're even willing to do, but just trying to limit the effects of the negative behaviors, if you do have any that kind of pop up into your life. And I mean, the other kind of the big ones, the self-care maintenance that I know a lot of people do struggle to get to is getting to all of your testing. The healthcare teams ask you for a lot of testing. We're asking constantly for different imaging results and different blood work and pushing you this way or that, or helping you qualify for oxygen. And so it's difficult, but it's very important, and it does fall under healthcare maintenance. Getting around with oxygen isn't easy, and sometimes we have to just help manage people's expectations of us by educating them a little bit too, and that can fall under healthcare maintenance as well, because if we're not managing the expectations that people have on us, if they don't understand how our diagnoses sometimes limit us, it can make life really tricky. Healthcare monitoring. So this is a big one. This is if you're working, with me, and this is the part of the stuff that we work on quite a bit. And this is some of the boring questions that I ask in clinic and that the doctors ask quite a bit. It's behaviors that we do to monitor our health. And so body monitoring, that daily self check-in, listening to input from your loved ones, so listening to that, maybe you have your daughter come by and she hasn't seen you in 2 weeks, and she says, oh boy, this is a little different from when I seen you, right? And so just recognizing those things and monitoring our health, because if we don't notice them early, they will they will build up on us. And some people like to use journaling because it is hard to remember day to day. Well, how did I feel last Wednesday? When Shane asks me, how many days has this cough been on, or how many days have I felt this way? Journaling, even just small little jot notes on a calendar throughout the day is, no cough today, or a little more phlegm, or more shortness of breath, things like that. So the goal of self-care monitoring, especially in this model, is to recognize that a change has occurred. And it doesn't necessarily mean that it's a negative thing. It's just recognizing that a change has occurred. We can't know that a change has occurred unless we understand our baseline. And so it's also very important to think to yourself, as you're going through kind of your self-care monitoring, and that's where journaling I find comes in quite handy, or even just like writing a baseline note to yourself is, how do I feel normally in a week? And how do I, when Shane asks me, when he calls, or when the doctor talks to me about, changes in my symptoms, it's best if we are able to kind of reflect back onto our baseline. And so that's what I mean. If you ever hear me say, if I'm speaking with you and you say, is, like, where is, are you back to your baseline? Now that you've done your prednisone and your antibiotics, do you think you're kind of back to baseline? Are you 80% of where baseline was? That's kind of what I'm referring to, is self-care monitoring, and thinking about it from our baseline, recognizing those changes that have occurred.
One thing I was thinking about, Shane, so I was diagnosed with asthma later in life, probably always had it, but could never prove that I had it. And I was so unaware of my symptoms, right? Like, because people are resilient. We just go through our day and we like, oh yeah, I got a little cough here or there, but you don't like, I never necessarily clued in to what was happening. And as I've gotten older, and I think with COVID too, we're all just a little bit more conscious of what we're feeling. And so that's part of, I think, the journaling you're talking about, right? Is just like keeping a diary of when your symptoms are happening. And that can really help you sort of identify when you're experiencing those symptoms.
Yep.
Am I right? Is that what you're referring to?
Exactly. Yeah. Just those, and recognizing, for you, that was part of your baseline, but was it normal? So being thoughtful about, like, even though this is part of my baseline, is this, what I'm experiencing, is that normal for someone, who doesn't have a diagnosis of asthma, right? And then recognizing, oh, maybe that isn't, and speaking with your doctor about it, right? And then, so many people who do end up getting diagnosed with interstitial lung disease, they say, that they'll tell you, because a lot of times it happens, later in life, they'll say they just started limiting their activity. They didn't recognize that they were becoming more breathless, or that they were limiting things, because they just said, well, I can't do that because I get short of breath. And they think to themselves that this is, deconditioning, or just, oh, I'm getting old. But it actually was part of that early disease process that we didn't notice. So, okay, I'll jump to the next one. Self-care management. This is kind of the doing. So we're working daily on our self-care maintenance, and we're attending to all of those things that we need to do, the learning, the taking our medicine, the this, the that, and then we're monitoring ourselves. We're knowledgeable about our disease, we're knowledgeable about our baseline, and we're knowledgeable about kind of, the things that are happening within our body. And then self-care management is the, kind of the evaluation of our self-care monitoring, and deciding, between yourself and your support group, someone you love, is this something that I need to act on? Does these changes that I'm recognizing in my body require input from my doctor or my nurse? And so, one of the really, really common ones that they use in this model, if you look this model up specifically, because it was developed for congestive heart failure, they talk a lot about swelling or edema. And so it's recognizing, I have more swelling. What is the action I'm going to take? And then, COPDers, I have more sputum, and I have more cough, and I have more of this, what is the action I'm going to take? And within COPD, we have the COPD action plans that some of you might be familiar with, because they're not all that dissimilar from what we should be doing in interstitial lung disease. And that's, kind of the changes that we recognize. We might have one bad day, and that's not great, but it happens because we have a chronic illness. But once we start having 2 or 3 bad days where we're having a change in our baseline that we've established because we're monitoring ourselves, we're having a change in our baseline for that 2 or 3 days, that's where we want to start seeing a decision on action. because then we can come in early. And it doesn't necessarily mean, that you have to call the doctor or you have to do this, but maybe it just means that you noticed a change and you want to decide, okay, you know what? I don't normally journal, but I'm going to start now for the next 3 days because I'm going to decide, I'm going to start managing this change in my body a little bit different. And then deciding, does this require input from their doctor or the nurse? Have you seen this change in the past? And if you have, what did it mean? What did it do? Like did this change in the past go away after 3 days and you didn't have any interventions because you pushed yourself really hard shoveling snow and you just got more of a cough? Or, is this something that's not happened to me in the past, and I'm kind of wondering how my body's going to react to this? And then remembering too, what has worked before and what hasn't worked. If you've decided that, you have had a day of increased activity and you're like, you know what, I don't think I need I'm recognizing there's a change from my baseline. I do have a bit more of a cough, but I'm just going to watch it. And that can be fine, right? That's an action. Increased monitoring, self-monitoring is an action. Or do I need to go and engage kind of one of my support networks? And that can be calling your daughter and saying, this is what's happening, or calling a loved one and saying, this is what's happening. And then just deciding on and taking action because you've gained an understanding of your illness and your baseline. And so that's kind of what I mean when I say self-care management. It's decision on actions and then evaluating them. Does anyone kind of have questions on that? No? Okay. So how can we support this? I've talked about this model. I've talked about these 3 kind of steps. What does that actually mean? And so I think that a lot of times it means just being more thoughtful about how we approach living with a chronic illness and evaluating our support networks and deciding for yourself, is this support network that I have adequate? Is this enough? Am I meeting all my needs? Maybe I've got a really, really good connection with Shane and my doctor, or maybe I have a really good connection with my family doctor, and that meets my needs as far as my my physical health is concerned. But am I meeting my mental health needs, right? And so evaluating those support networks and thinking to yourself, do I need to connect with a friend more? Do I need to go and see a counselor formally? Do I need to engage in a different kind of network that's going to help me with my mental health, right? And then gaining an understanding of your diagnosis will support really all of the steps that we've talked about today, because it's going to help you recognize kind of more thoroughly the things that are happening within your body and the things that you should be paying attention to. And so, I'm sure that most of you, when you got the diagnosis, if you're a participant today that has been diagnosed with an interstitial lung disease, you probably started looking at some of the paperwork that the doctor gave you, or you went and found a video and you went through it and you kind of recognized, and that is awesome. That's valuable. Those things are really, really good places to start. But if it's maybe been 2 or 3 years since you read that book, or 2 or 3 years since you watched that video that was put out by the Lung Association, or, there's several different really reputable places we can get that knowledge. And if it's been a few years, it doesn't hurt to go back and start at the beginning and go through some of those videos and those tools that talk about diagnosis and the specific diagnosis within our umbrella of interstitial lung diseases, right? Because not all of us have the same specific diagnosis. And then identifying our barriers. Financial can be a big one, that's all well and good for Shane to say, go and get some mental health support. But what if you can't drive to your counselor? What if you don't have a counselor available to you in your community? And that's free. And so do you have the ability to have third-party coverage, like, your Blue Cross and this and that, help with that counseling? Nutrition, those things are hard to access, and there's wait lists. Finances is a barrier to people, because if you have money, you can pay for those private services, or if you have that coverage. And so I don't have all the answers for it, but identifying the barriers to self-care is helpful. We live in rural Saskatchewan, many of us. I myself am 30 minutes away from anywhere. So geographical, barriers to self-care could be geographical. Sometimes I don't want to go out and go for my daily walk because I have the dairy barn down the road hauling manure, and I would either get spanked by them or the dust would kill my lungs. And it would be, so like there's certain barriers that we have imposed on us because of where we live. And then, like I said, access to resources is different in all of our communities. And so those are barriers. And then lastly, the big one is our coexisting medical conditions that we have. Those can be barriers to managing our chronic diseases kind of ongoing, because sometimes if we have an acute change, like a sudden change in one of our other diagnoses, because the body is so interconnected, it might cause a flare up in your interstitial lung disease, but also it can make you have that chronic disease that you're monitoring and you're doing a really good job of, take a back seat. Because sometimes right now, the fact that your blood sugars are all out of whack, or the fact that you're having, issues with your heart and your blood pressure medication and all of those things, they shine a spotlight on those things, and they take away from the managing of our chronic illness. And so again, I don't have great answers for it, because life happens, and sometimes it is important that those things take precedent over kind of the mind space that you use to manage your chronic illness. But just identifying that those are barriers to our self-care.